Ladies and gentlemen, I introduce Dr. Baik. I'm so grateful for your time, and you are the founder of this clinic, which you're recording at. And you are currently an eye doctor in South Korea. South Korea is known for world-class surgery for almost all things.
True.
I would just love to ask, how did you go about building this clinic?
Yeah, first of all, thank you for inviting me. Thank you for coming into my clinic. I'm so grateful that we're doing this here, using my clinic as a studio. So it's just, it's a great time. Yeah. So, um, I founded this clinic 11 months ago, trying to be a little help for everybody, because eye is sort of unknown area even for the other doctors. It's so it's so it's a specialty that is not known to many people. So I wanted to create a clinic that would be a strength to everyone's eyes, explain a little more, spend more time, and be a little helpful even to Korean patients and English speaking patients. So that's my current goal, and I guess it's going to a right direction.
What's been kind of like your, I guess, business model, and how do you go about, running this entire clinic?
Mm-hmm.
What are the processes inside?
Mm-hmm. So I have a very unique background. I graduated from international school in Korea. I went to a American college in US, and I actually majored in engineering. And I used to be a semiconductor engineer for a couple of years before heading into medical field. So I have a very unique background of being Korean American and being an engineer before coming into medical field. So I wanted to be a little bit. I wanted to differentiate myself from other, I guess, doctors or clinics to have a unique perspective on patient experience and um, have a better, comfortable space for patients to really uh, be taken care of. So guess I don't really have that business model or a benchmark, but I want it to be. I want this clinic to be a comfortable place for multinational patients, and that's my goal. And I specialize in cataract surgery, refractive surgery, contact lenses, and dry eyes. It's something that a lot of people in the world actually experience. Cataract is probably the number one eye disease that everyone experiences, and refractive surgery is something that young people like myself actually had uh, improve their quality of life. And dry eyes are it's just prominent on everywhere because of the development of smartphones and computer usage. So I wanted to provide a world class treatment for basically everyone, and I want my clinic to be a comfortable place for everyone to heal their eyes.
It certainly is very comfortable. That's like a big couch, and it looks very nice. Man, I'm kind of curious, like what, because it's quite of a big leap of faith building a clinic and getting the money to build one. Why you have this vision of yours? Was there like a moment that kind of led you to this?
Um, it wasn't actually a big motivation, but it's basically a natural process for Korean doctors. There's basically mm, three pathways. You would stay in college to become a professor, to research and um, create a better treatment for treatment for certain diseases. Be a really specific specialist, even within eyes, or you can um, work for other people. Um, we call them paydocs in Korea. And then you can also build your own clinics. And building my own clinic would um, allow me to have to, I guess, freely express my own ideas and um, have a provide unique perspective on treatment plans. So I didn't want to follow certain protocols. Not that I'm doing this weird treatment or anything, but I wanted to have more intimate um, relationship with the patients as an owner. So I wanted to control my treatment plans and um, even as an engineer, I used to be a standardization and optimization specialist. What I wanted to do in my clinic. I wanted to optimize patient experience and standardize what I do and have a little efficient way of treatment plans. So that's what I'm trying to do here at my clinic.
What's your like key things you've done at the moment to optimize for client experience?
Basically, dry eyes, treatment of dry eyes is a little, it's pretty complicated. It's a multifactorial um, disease, and it's really hard to actually perfectly overcome that disease. It's basically a management rather than a treatment. So I created this IPL dry eye treatment plan, um, which goes by doing specific diagnosis plan to explaining what specific dry eyes that you are having and to giving a specific one-to-one specialized personalized treatment plan for everyone. So that's something that it kind of utilized like Korean dermatology package plans. So it's something that I'm doing. I'm utilizing that kind of idea to eyes to personalized treatment of dry eyes.
And I just love your intake because you studied abroad and also in South Korea. From Korea, you studied in Northwestern. And based on your own understanding, what would you say are like the differences in like the healthcare and specifically maybe the eye industry, industry or just clinics in South Korea to U.S.
Mm. I guess medical field, international medical field has been globalized. So with the development of internet, the knowledge and information and research is shared by everyone. So it's not that Korean and U.S. is a little different. It's not that different, as in treatment plans or anything. But then I think Korea medical field is a bit more efficient because it costs so little. We have to see a lot more patients than American doctors. So it's much more optimized and we see a lot more patients. So I guess, doctors by doctors, we experience more diseases and more different eyes. We see a lot more patients. So I guess the downside is that we don't have enough time to focus on each individual, but then we have enough data to to make more faster decisions in an efficient way. So there are pros and cons, but it's the medical field or medical insurance system is a lot different. So I guess that's the biggest difference. Um, the medical school system is pretty similar. We learn with American textbooks, so we use the same textbooks. Um, the resident, intern, medical training, specialty training system is very similar. And yeah, we study with, we keep ourselves up to date with international research papers. So I guess, information wise, medical knowledge wise, it's up to date worldwide. But then patient experience and how we approach patients, it's a lot different.
Hmm. You mentioned you get more than American doctors. I'm surely that you sometimes get overwhelmed. How do you go about managing? You have a lot of people to deal with. How do you manage those difficult situations? I assume when it becomes maybe too
Mm-hmm.
much sometimes.
Yeah, one of the most difficult thing is that I have to work 6 days a week. So it's kind of overwhelming personally, physically, I guess. But then I always try to remind myself that these people are spending time to come over here, come all the way to this fifth floor and ask for help. And I can't be like, just thinking about myself being physically, drained or fatigued. These people are coming here for help. And it's something that I've been dreaming of doing, helping, giving a primary help to people, even if I don't even know them. I want to be that person. I want to be that go-to guy that gives like a quick treatment for everyone. So it's basically living the dream. Yeah. So I just need to remind myself, even if I'm fatigued, I would remind myself that yeah, these people are coming in, like spending a lot of time, even money, to see me, specifically to see me because I'm the only doctor here right now. So I would, yeah, give my everything to each and every one.
So you're driven by the purpose of helping other
Mm-hmm,
people, and
mm-hmm.
that's just giving you,
It,
yeah.
it- it's it's a big joy to um, be able to help people and treat people's eyes and given the information that um, they weren't provided. Because again, going to a Korean system, because doctors see a lot of patients, a lot of busy clinics, they would see about 100 to 120 patients per day for each doctors. They don't have time to explain things. But then my primary purpose is not to make money, but I wanted to resolve the issue, explain, and give the relief that people deserve. So that's something that I focus on. I try to explain a lot more. Yeah, and yeah, and I think I'm getting positive reviews from neighbor. So I guess I'm doing the right thing.
Yeah.
I'm heading to the right direction. So yeah, it's really n- it's really fulfilling. It's very satisfying that people are thanking me for explaining because yeah, I've been hearing things like um, one patient said to me she had glaucoma for about 5 years and nobody ever explained to me about how she got this, why she is being treated this way, why she is using this eye drop other than this eye drop, and yeah, I mean, yeah, those patients they deserve better. So yeah, I try to explain things more than they want. So yeah, I kind of talk a lot.
Helping people understand. Would you say that's a big issue with a lot of doctors, or specifically in Korea, or just maybe in the world that they don't explain the treatments and what's happening in the process?
I mean, I understand why, because I also was in busy hospitals and yeah, it was just overwhelming. There's just no way I can explain things for more than 2 minutes. It was just 30 second to 1 minute because if I don't do things, if I don't resolve see this patient in if I don't see this patient in 1 minute within 1 minute, the others will be waiting for hours and they wouldn't be able to go home. My employees wouldn't be able to go home for hours. So um, yeah, I guess I have a privilege here as a new clinic that I don't have that much patients. So I have a privilege of having more time to treat one patient. But even if more patients come in, I am going to try to um, keep that culture. I would, you know, I would bring in more doctors to do the same thing that I do, and I would, not try to lose that focus. And one other thing is that um, a lot of English speaking patients would come in, and I I saw a lot of tears coming in from their eyes because they really had a hard time being in foreign country, being sick, but not being explained um, enough. Because I mean, Korean doctors, they might not be able to speak English more fluently than I can. So the way I would explain, they would just go in tears because they wanted it. They needed it. So yeah, I love seeing English speaking patients, and I really don't know how to promote that I am here because yeah, I don't have any English signs or anything, but somehow they would find out and come in, and I would explain things in English, and yeah, it's a big joy um, to resolve their issues, and yeah, just resolve their uncertainty and unknowns. Yeah, yeah. I love seeing English speaking patients.
Hmm. Yeah, your English is very fluent. You actually studied in the same school I currently attend international school, which is very interesting. Um, and yeah, I mean, I'm just curious because you have to, manage the, how much you help people, but you have to also have to make sure this place runs with enough money. How do you go about managing that? Because that was something. That's why I was kind of worried about going to healthcare. It's like, how do you manage that? I feel like that's a moral. Like sometimes you might wake up at night like, maybe I should make it cheaper.
Yeah, it's really hard to if you focus on like the business side, it's really hard to focus on like treating patients. So whenever I'm seeing the patients, I try not to think about the business side because I don't want to overdo it. Um, um, I don't want to do unnecessary tests um, because I don't want to give unnecessary burden on the patients. But yeah, I guess yeah, I should start thinking about the business side. Um, but it's hanging on. Yeah, it's great that I don't have like a specific business knowledge. If I did, I would definitely try to. I would have to overdo it right now, but yeah, I have time. I'm just I guess I'm being ideal, but I'm thinking if I keep on doing my own thing, being unique, differentiating my own style of um, treating patients, I think my clinic would it naturally grow. Um, then I would bring in more doctors, more employees, and yeah, guess it's my goal to build a unique culture. Um,
I mean, that seems kind of aligned with like a very prevalent startup culture, especially in like Silicon Valley Y Combinator, which is you really focus on the customers, the product, the people you're actually helping, and a lot of people make the mistake of just focusing on the business from the start, which makes sense. You need money, but I think that's lovely. Um,
oh, the other thing is that it just popped into my head. Whenever Korean doctors plan to build their own clinic, there's this medical consultant. They approach to you. I don't know. They find out somehow. Um, they would give a little. They would show you the easier way of making money. There's just loopholes to Korean medical system, and they would consult you on the business side. But yeah, I didn't want that. I didn't want to go to that easier side. I didn't want to build a clinic to make money. It's that money wasn't my goal. So yeah, I guess my friends would say, um, why didn't you take a easier way, shortcut? But yeah, that just wasn't my thing. So yeah, I guess I'm learning the hard way on the business side. But then yeah, I try to focus on the patient that I have that I'm seeing in front of me. So yeah, business. Yeah, I guess I'm hoping that it would naturally, yeah, follow.
Hmm. And talking about you focusing on the customer, how would you say, like, this is something I'm very curious, how much hours would you say you spent on just like studying and like practicing the industry of ophthalmology, or like
Mm.
just like eye surgery
Mm.
stuff?
Well, the great thing about medical field is that you can't use old knowledge because it's constantly changing. It's constantly developing.
So
So
textbooks are constantly changing,
yeah, yeah.
year to year.
I mean, the textbooks are coming in every like 5 to 6 years, but then these research papers they would come in every month.
So research papers are like your primary information these
Yeah, like
days.
yeah, yeah. So, I mean, textbooks are for I guess it's a standard, global standard that is set, but then new technology and new ideas are much more quicker. So I really have to keep myself up to date on those papers. So yeah, it's never boring. It's really fun, and yeah, I really enjoy trying those new technology.
By trying those new technologies, do you like purchase them and then play with them, or
It's a little different. Uh, the medical field is that there's this, if there's certain eye drop, if it's effective for certain disease, but then this new research paper comes up, it's also effective for this disease, and I would, try this,
on
um,
your
yeah, on the
and
patients.
then that's like, so if there's like a
If
decent
the medical insurance allows me to do
ah
it, yeah, there's a little boundary, but then yeah, I would have to keep that boundary and laws as well. But yeah, yeah, I mean doing these new technologies, keeping up to date with new ideas, especially on like the refractive surgery side, LASIK and LASIK. There's just like small techniques, small new techniques that would be helpful on certain type of eyes. So I just love trying out those things and see if what works best for my own patients. So yeah, it's great.
talking about learning, are there any like doctors or specific people who may not be doctors or past historic doctors that you kind of look up to, that you kind of use, or
Yeah, there's certain doctors who are really famous. Um, I always go to this YouTube channel called cataractcoach.com. Um, his name's really hard. His name's really hard, but then I would go to his website or YouTube channel and watch his technique, and he also posts other world renowned doctors' techniques, and the, for even cataract surgery, there's so many techniques. So um, I would definitely try to master those, and after mastering, I would find out another technique that would be more helpful on this certain eyes and try those. So yeah, those are really fun too. And there's this other um, world-renowned figure in refractive surgery, LASIK and LASIK. Um, sorry, I forgot his name, but he's Dan something uh, from UK. It's mostly YouTube videos nowadays and research papers. So yeah, I would subscribe to their channels and subscribe to their papers and see if what they're thinking. And yeah, even if they don't know me, but yeah, thanks to YouTube and thanks to internet, I can keep up to you know those renowned techniques. So yeah, these are yeah, YouTube is really helpful for
hmm.
doctors. Yeah.
I mean that was kind of like a, like, I never expected like doctors would go to
Mm.
YouTube. But what would you say are some like conceptions people have, or understanding they don't have about the healthcare industry? Maybe it's eye doctor, just generally healthcare industry, that people have and that you figure out was wrong when you got into this industry.
Oh. I guess there are so many misconceptions about eye doctors because the information is so uh, limited to general audience. Even if they try to understand, there's so many specific knowledge that is required to understand a certain disease. So there's this, internet communities like neighbor cafes or Reddit even. Um, there's so many misconceptions about surgeries and dry eye treatments, and um, I guess nowadays doctors do a really good job on trying to correct them, trying to provide standardized um, information. But then back in the days, like even 10 years ago, just, there's so many wrong information out there on the internet. So even now, it's best to consult a specialist. Um, a lot of people rely on the information on the web, but then it could be different from your own.
Exactly. Like
Yeah.
all my friends, it's a common joke we make is when we have a headache and we are sick, we search up and it says we have cancer.
Oh yeah, yeah, yeah. Or a brain stroke or anything. Yeah. So don't just rely on the information out there. Consult a specialist, especially in Korea. It's really accessible. It's so easy to approach to a specialist. So yeah, I know it takes time and effort, but yeah, just try not to trust um what's out there. But yeah, the doctors have a personalized idea on your condition. So yeah, talk to your eye specialist. Yeah.
I mean, I'm just going back. You mentioned about how technology, like you have to constantly stay up to date in technology, and you also previously mentioned some inform that understanding like you only have 1 minute. Those things seem to be things that technology could kind of solve issues, and you've mentioned before, since you've actually had a talk at our school, that you have mentored some healthcare startups. What would you say is around the healthcare startups, and what are you excited about? Maybe specifically in the eye industry of technologies that may come, and where the trajectory of it is going at the moment.
Yeah, I mean, there's so many apps or programs that aids doctors um, to provide a better to make better decisions. Um, Back in the days, you would have to look up in the book and see if you would have to it's like a quiz. This patient has these kind of symptoms and these kind of conditions and these kind of background. You would have to narrow down on your own reading the books. But then what AI technology and what those optimized programs do is that you write down the symptoms and age and basic background information. And what it does is that it lists down the most probable diagnosis and least probable diagnosis and treatment plans as well. So I think there's an
And you use them at the moment.
yeah, yeah, yeah. I
Oh,
think there's an app that came out recently that does that. I think it's really actually open to general public as well. Uh, I, I've seen some Twitter or X of the developer um, promoting it, but I'm not, yeah, I haven't really tried it. And the other thing is that we doctors we actually um, for cataract surgery you would have to calculate beforehand for personalized intraocular lens that goes in after the cataract surgery. We actually utilize a program on the internet to put in the properties of the patients, and the most optimized lens would pop up, and it would automatically order that lens. And yeah, that's one of the yeah, I wouldn't I can't even imagine doing selecting the lens without the program right now.
really? So
Yeah.
art of machine learning has already become an integral part
Oh
of the
yeah, yeah,
process
yeah,
as well.
yeah. So yeah, the eye surgeries are yeah, we use latest technology, and it keeps on changing. The better ones are coming in every year. So yeah, it's becoming easier for patients and doctors, and I think some of the AI technology would also take over some of the jobs that doctors do, which is pretty scary. But then, yeah, I mean, it makes sense. Yeah, it makes sense.
And then you said you mentor like healthcare startups. What kind of like advice do you tell them at the moment?
Yeah, yeah. It's basically, yeah. What I mentor is that there's this company that does it's an AI company. It interprets the fundus photo, which is the inside of your eye. You have retina, and you have blood vessels, and you have optic nerves, and it would automatically diagnose what kind of problems that you have, and it would actually, yeah, show you, like, predict even the age of the patient of the photo. What I do is give an advice on how to make money out of it. Um, I guess it's not related to like medical scene, but they would ask me how would this technology be utilized in private clinics, and I would give an advice on how patient would utilize this kind of technology in their own life, and go on with that. So these kind of things, these kind of basic things, are trying to give patients more information about their own health, and those blockchain technology would have all the health information about yourself within this chip, and that would basically help doctors and patients to have a better idea about yourself. So I think it's very near. Um, Technology and medicine, the combination of those two would be a very effective system, and very effective on keeping personal health. But the other side is that many doctors wouldn't be needed if AI takes over.
Yeah, and do you see that complete takeover? Do you see it as a tool that doctors will ultimately use?
I mean, it would be a tool, but then for certain areas, it would completely take over. Um, I don't know about, specifics of, like, um, basically image, um, imaging side. Nowadays, doctors would take a look at the pictures, or X-rays, or CTs, or MRIs. Um, they would diagnose the disease. They would see the abnormality with their eyes and decide with their brain. But anyone would think that that could be done using AI.
And then just
Yeah.
going away from
Mm-hmm.
AI, robotics has also seen a lot
Oh
of
yeah, yeah.
advancements. How do you think robotics will affect?
Robotics.
Because I heard so this is in that
Mm,
Tesla, they in one of their manufacturing plants,
mm,
they actually was using a robots level, but some parts of them they chose not to because
mm,
the cost to develop it actually was not worth the difficulty of very
mm,
minor
mm-hmm.
adjustments. Do you think that will happen the case, or do you think these minor things will be just easily done by robots?
I think robotics would be certainly a big tool for doctors to utilize, but then it'd be very hard to take over, because every patient is so unique. You would need human decision maker to do a certain operation, especially in the eye. The eye surgery is so microscopic. Even you will need like very tedious jobs, and you would need like specific hand functions to do a, do these eye surgeries. But then robotics would be a definitely it would definitely be a pretty good tool to help uh, certain areas that human hands can approach. or remote surgeries and those kind of things. But yeah, yeah, I don't know about 20 years from now on. I can't imagine. Yeah.
Hmm. I mean, I'm just curious, because you already use the software, some of the softwares.
Mm.
Yeah, to the extent where you can tell, like, how much do you like pay for them? Like, how do you go about like using them and finding them?
Oh, these kind of softwares are
Are they
yeah,
pricey?
yeah. We don't pay them.
We don't pay?
Yeah, I mean we're buying their lenses,
Yeah.
so we're using them for free.
Really?
Well,
Oh.
yeah, because yeah, it's not really a complicated program. It does the calculation and everything. But then these specific calculations for intraocular lens selection, um, some specific calculations, you have to pay for it, and um, basically it's called biometry um, machine. I have them right there. Um, if I buy the machine, the company actually gets the license from the software developer. So it's embedded already in the price of the machine. So I don't really know the specific price of using that calculation, but it's embedded in a machine. And the machine itself is pretty expensive. So
But you just pay one time. You don't pay like a monthly.
oh, there's certain calculations that does it, but then yeah, I don't use that one. I forgot how much it cost, but it's very expensive. So I don't, yeah, I don't, yeah, yeah,
You don't want to think about
I
it.
don't need it. Yeah, there's plenty of really good calculations that are free. I actually not free, but available.
I mean, I like to like move on to more personal notes. So you have one son, and you have a son coming up next year. How do you manage your time? Because you say you stay in 6 days, and you're very busy. And I'm so thankful for your time. Like, I know how much it's worth. How do you manage it? Because that seems like a very tough thing.
Oh yeah, but nowadays we have iPads, we have laptops. So yeah, I mean after work, I would you know try to spend more time with my family. I would try to help my sons do their math homework or do their English homework. But then, um, yeah, right now my son's in third grade, so he can do his homework on his own, and I would sit right beside him and read my paper, use an iPad. So we're studying together, so it's a fun times. So yeah, I guess we're doing this. We're doing different things, but then yeah, we're spending time together, studying. Yeah, trying to be better each and every day. And yeah, yeah, I kind of miss spending time with my family during Saturdays. I really miss going to YSS Dad's Club Soccer.
Ah,
Yeah, it's always on Saturday mornings. I can never go, but yeah, that's kind of things that I have to sacrifice for now. Yeah, but yeah, after if my clinic grows, I if I can get if I can get another doctor to hop in, I would have more time to do some other things like interviewing. Yeah, yeah, I definitely would want to do my own YouTube as well. But yeah, so yeah, that will be coming in the future. Yeah.
hmm. And I'm just curious, talking about time management. How do you schedule like what's your like a day in the life? Do you like you wake up at this time and then you work, and when you work, like do you have like blocks of time for getting people, blocks of time for surgery, blocks of time? How do you go about doing that?
For now, it's a young clinic, so I don't have like a allocated time for surgery or outpatient clinic. I just do them. Um, the good thing about eye surgery is that it only takes like 15 to 20 minutes. So, the patients who comes in during the surgery time, they would wait or do a testing a little bit. So, I don't really need allocated specific time for surgery. But then, if the clinic grows, I most of the clinics they have patient. They have specific time for outpatients. They have specific time for surgeries for certain doctors. So that should come in the future. But for daily life, I would wake up at about 5:50 in the morning. Get myself ready, get my son ready for school bus, and after sending my son to a school bus, I would work out for 40 minutes.
Do you do a lot of forearm exercises? 'Cause I'm assuming you need a lot of stabilizer.
Yeah, that's the thing. I don't do like weightlifting because I really need, micro movement. So having more muscle, it kind of that's what I think. That's my excuse of not doing the weightlifting thing. Yeah, I would, that would hinder, micro movement. But
Would you say you're very strong in your forearms?
oh, forearms? No,
No, no,
not really.
no.
I guess orthopedic surgeons are really strong, but
Oh,
eye surgeons aren't. Yeah, no, we're just,
you
yeah.
guys are just very precise.
Yeah, we're just a little precise. Yeah,
Wow.
I guess I hope.
You
Yeah,
hope.
yeah, yeah.
Otherwise, you have to apologize
Oh yeah, yeah,
for
yeah,
4,000.
yeah. I
You said
mean,
it was written like you had 4,000 surgeries while it was coming up. Is that true? Or
oh,
more?
like yeah.
And when you do these surgeries, like I just can't imagine being a surgeon because you need to be calm. It's like very
Oh yeah,
important.
yeah,
How
yeah.
do you manage that?
So at first it was really scary, even touching the eye. Like when I was a resident, it's just I almost panicked. Just looking at the eyes. But nowadays it's really fun. Um, I don't I think I shouldn't say this, but it's like playing a game. it's it's basically trying to perfectionize what I'm seeing right now. So like back in the days when I play, StarCraft or League of Legends or even Super Mario, you want to like, perfectionize and you want to like finish this early. So I would always try to like, make it perfect and just focus for 20 minutes and finish that up in faster time. So it's really fun. Yeah. So you don't really think that I'm treating a live person. That's the thing. Because having that emotion kind of hinders the decision. So you have to be really cold blooded. Like during the surgery, you have to be you have to be super focused. You have to be cold blooded. You don't want any mistakes. So surgeons get really sensitive during surgery. So I always apologize to my assistant. Sorry for being so mean, but yeah, I can't allow even a small mistake. So yeah, it has to be perfect. It has to be fast.
Hmm.
Um,
And
so
when like mistakes or issues do occur, you're very quick at solving.
oh yeah, definitely. You
Yeah.
have to have a plan.
So you have a
So
plan for every single
oh
mistake.
right,
Like
yeah,
very, very thorough.
yeah. So um, we call it image training before the surgery. Before each and every surgery, I would train myself. Just in my head. That's just not a routine surgery. I would always imagine about the worst case scenario. What would I do? I think yeah, that's what I think differentiates a professional and an amateur. I guess for amateurs, the goal is to accomplish or finish the job. But then if you're a pro, you have to be ready for everything. You have to be ready for the worst case scenario. So the routine cases, I don't really worry about that. But then the hard cases, worst case scenarios, I would always try to perfectionize on that. So, well, the best thing is not happening. Those kind of things not happening. But then, yeah, it's the eye. Every eye is so different. So you have to be ready for the worst case scenario. So I think that differentiates amateurs and professionals. Hmm.
7:30. So I'm curious. So, what are your future goals at the moment? Your father, more sons coming up,
Yeah,
clinic growing. What's your goals?
I guess recently this was my goal. So I guess I kind of
Congratulations.
yeah achieved my goal. So my next goal will be developing this clinic, making it bigger, providing a better service for all the patients, building a system that would differentiate my clinic from others, and I kind of want it to be a center for English speaking people in Korea because
For healthcare or just for eye surgery?
eye surgeries and eyes. Because yeah, I'm not. Yeah, yeah, it's not there yet. But eventually maybe. But then, yeah, for eyes, I want to be the help for English speaking patients. And yeah, I also I wanted to do volunteer work or provide cataract surgery or any other surgery for people in need in developing countries. And yeah, that's certainly one thing that I want to do in the future. So yeah, providing free surgery in Korea is illegal, so you can't do it.
Really?
Yeah, it's
Just
illegal.
legal. Wow.
Yeah, yeah, you can't do that. But
That's interesting.
yeah, providing it in third world country would be one of the goals that I have. Um,
Yeah. This is the last question I ask all my guests. Is if you can travel back in time to when you're 17 years old and you're actually at the same school I was studying at 17, which is funny. What would you tell yourself?
I would actually do tell myself to do a podcast like this.
Oh,
Uh, meet some experts, meet people, experience. Um, I guess one of the life changing experience that I had during my 10th grade year, just before my 10th grade year, I actually went to a summer school in the US. It was called Phillips Exeter Academy. It's one of the top boarding schools in America. It was life changing because I went to a same school for a number of years. I had friends that never changed. I had my own comfort zone. But then when I went to that school, I was out of my comfort zone and I saw how the world was running. I saw how um, bright students of my age are thinking differently and behaving differently. So it kind of opened my eyes. Um, so experiencing a lot of different things, just trying out, trying to be an expert at certain areas, finding out what you enjoy, what you really enjoy. You just have to experience, and you just have to go out in the world. So I would tell myself to, grab a camera, do a video log, or make a podcast interviewing people, just talking to them. Because there's so many things that are going on in the world. Um, and you have to have your own idea or your own standard uh, in living life because you have to make a lot of different difficult decisions. So you have to know exactly what you want and what you go by. So experience, explore the world, and try to make a difference. And yeah, so that's exactly what you're doing. So I really admire your work, and I would definitely tell my son to do these kind of things to explore the world and see what's right for you. Yeah. So this is great. Yeah.
appreciate it. A
Oh.
free promo, I guess.
Mm.
I can help your son as well.
Oh yeah. Thank
Someone I
you.
actually interviewed as well. His son is 11 and he has a podcast as well.
Oh
I don't
my.
know why the podcast is growing, but yeah, it's really appreciate your time, Dr. Beck.
That's
It's a very
cool.
precious
Yeah.
time. I'm so thankful and thank you so much.
Yeah. Thank you. Thank you for coming in. Yeah.
Okay, podcast over.